Healthcare must be thought as an investment, not just as a service provided. It should be part of the economic development plan of a country to invest in its health.
There will be a world after COVID, and what we do now will have repercussions when the COVID epidemic is long gone.
The impact of this virus on prevention and control of circulatory diseases has been profound and will result in permanent changes.
There's a vortex of change related to education, to the way in which we deliver care, to the way in which we interact with individual risk behaviors, and a need for us to understand how we interact with systemic inequities that are too often stratifying our opportunities for care for everyone, everywhere.
I don't think we're going back. The financing of all this will change dramatically. COVID-19 didn't create, but it certainly did expose a lot of challenges and disparities in healthcare around the world. We need to focus on prevention, detection, and interception of disease versus the over-focus on treating end stage of disease. This is how we'll save lives, massively reduce the cost, and dramatically improve the clinician experience.
Whatever the healthcare field, to push forward in collaborative spirit across all disciplines. In medical school and pharmacy school and nursing school, they're starting to work together and learn how to do that. In the United States, pharmacists in 48 states are permitted to prescribe under this collaborative drug therapy management agreement model. The regulatory bodies in the United States have helped support a model which can really help our physicians and obviously our patients. From the physician perspective, we're able to alleviate their schedules for patients with more severe diseases or pressing needs.
My country, Somaliland, it's a country that has known war for many, many years. In 91, when the country emerged, 95% of our cities were leveled to the ground. Hospitals were destroyed. We had no cardiologists, and we still have no cardiologists, no cardiac units. We cannot offer surgery to cardiac patients. The best we could do is help with whatever little knowledge we had in the treatment of patients with heart disease. We began to treat them and try to keep them alive as best we could. I would be happy with scholarships for our brilliant junior doctors to be trained to come back and make the country self-sufficient. My money would be on training the next generation of health professionals.
There are huge needs, and the money available is quite restricted. Even before COVID, we spent more on health in as much as economies grew. When economies don't grow, we also see a shrinking of spending on health. Even prior to COVID-19, governments were not necessarily doing as much as they could to prevent non-communicable disease and CVD, and then to use clinical resources as well as possible. There is evidence that doing well on managing cardiovascular disease and other NCD burden is correlated with higher levels of productivity. That economic evidence is pretty clear.
My message for health ministers, of health policymakers, to learn the jargon and the language they use economy. In terms of cost effectiveness analysis, return of investments, in order for them to understand what is the messaging we are trying to convey. What will we see when the veil of the pandemic is lifted is really unknown. We will have to deal with the health and also the economic consequences of chronic diseases left unattended in this period. Maybe the pandemic could be seen as an opportunity to move health and health policies higher up in the government and social agenda.
The first thing that we were asked was to help protect the workforce, make sure that we had adequate personal protective equipment for all of our providers, because we knew if we couldn't protect our workforce, then rapidly our system was going to be failing. Telemedicine rose to the forefront. Even you make that easier, if it doesn't get paid for, then it's not going to happen. So reimbursement became an issue. That rapidly changed, and we saw telemedicine go up. Our main goals are to make sure we watch very carefully the impacts on any of these things on social disparities of care, that we use the entire cardiovascular team, making sure that we're supporting our providers, because people are under a lot of stress, and that's something we have to watch for.
COVID will not be here forever. COVID will make us stronger. Determination is the word of the moment.